The World Health Organization has just declared Mpox a global public health emergency. Again, sound familiar? It should, because it's eerily reminiscent of how the COVID-19 pandemic began. You might be thinking that this might actually cause another lockdown, but don't panic just yet. Let's break this down first. In 2022, we saw a significant Mpox outbreak that spread to multiple countries. Many of us breathed a sigh of relief when case numbers dropped. But here's the twist: a new, more aggressive strain of Mpox is now causing havoc, primarily in Africa. This isn't just a repeat of what we've seen before, it's potentially much worse. And it's giving us flashbacks to how COVID-19 evolved and spread. The epicenter of this new outbreak is the Democratic Republic of Congo, where over 14,000 cases have been reported, with more than 500 lost their lives. What's particularly concerning is that this strain is affecting children more than previous outbreaks, and it's not staying contained. Neighboring countries that have never reported Mpox before are now seeing cases. Remember how quickly COVID-19 spread from country to country? We're seeing a similar pattern here, albeit on a smaller scale so far. But why should we care about an outbreak in Africa? Well, if COVID-19 taught us anything, it's that in our interconnected world, diseases don't respect borders. Case in point, Sweden just reported its first case of this new strain, marking the first time it's been detected outside of Africa. This is why the WHO's declaration is so crucial. It's a call to action for the entire global community, much like the early warnings about COVID-19. Now let's take a step back and look at the bigger picture. Unlike COVID-19, which was a novel coronavirus, Mpox isn't a new disease. It's been around for decades, primarily affecting certain regions in Africa. But in recent years, we've seen it behave in new and unpredictable ways. The 2022 outbreak showed us how quickly it could spread globally, affecting communities that had never dealt with it before, much like how COVID-19 caught the world off guard. This latest development is particularly worrying because of the strain involved. It's called Clade 1b, and it seems to spread more quickly and have a higher mortality rate than what we've seen in recent outbreaks. This isn't just about more cases, it's about potentially more severe cases and more lives at risk. It's reminiscent of how different COVID-19 variants emerged, some with increased transmissibility or severity. So what does a global health emergency declaration actually mean? Essentially, it's the WHO's highest level of alert. The same designation given to COVID-19 in January 2020. It signals that this outbreak requires a coordinated international response. This declaration can help mobilize resources, increase collaboration between countries, and speed up the development and distribution of vaccines and treatments, all crucial elements we saw in action during the COVID-19 pandemic. Speaking of vaccines, there's some good news on that front. Unlike the early days of COVID-19, we already have a vaccine for Mpox. This vaccine has shown to be at least 85% effective in preventing infection. The challenge now is making sure this vaccine is available where it's needed most. The United States has already committed to sending 50,000 doses to the Democratic Republic of Congo, which is a start but likely not enough given the scale of the outbreak. This situation highlights the importance of global vaccine equity, a lesson we learned the hard way with COVID-19. Now, I know some of you might be wondering, is this going to be another pandemic? Should we be panicking like we did with COVID-19? It's a valid concern, but it's important to understand that Mpox is different from COVID-19 in several key ways. It doesn't spread as easily through casual contact, and we already have vaccines and treatments available. That said, we can't afford to be complacent. If COVID-19 taught us anything, it's that early action is crucial. The fact that this new strain is affecting children more than previous outbreaks is particularly concerning. It raises questions about how the virus might be evolving and whether our current understanding of its transmission and risk factors needs to be updated. This is why continued research and surveillance are so crucial, just as we've seen with ongoing COVID-19 studies. Another aspect we need to consider is the potential for stigma and misinformation. During both the 2022 Mpox outbreak and the COVID-19 pandemic, we saw how quickly false information could spread, leading to fear and, in some cases, discrimination against certain communities. It's crucial that as we address this new threat, we do so with accurate information and compassion, learning from our experiences with COVID-19 misinformation. So, what can we expect moving forward? Based on what we're seeing, it's likely that we'll see increased global efforts to contain this outbreak. This could include more vaccine distribution, enhanced surveillance and testing, and potentially travel advisories for affected regions. Sound familiar? These are all strategies we saw deployed during the COVID-19 pandemic. But it's not just about governmental action. Each of us has a role to play. Just as we did with COVID-19, if you're in a high-risk group, which includes those who are immunocompromised, have chronic diseases, or have a history of eczema, it's important to stay informed about vaccination options. For everyone else, staying aware of symptoms and practicing good hygiene are key. And remember, if you notice any unusual skin lesions, it's important to contact a healthcare provider. These precautions might remind you of early COVID-19 guidance. And that's because these basic health practices are universally important. But beyond these practical steps, I think this situation calls for some deeper reflection. It highlights the ongoing challenges we face in global health equity, an issue that was glaringly apparent during the COVID-19 pandemic. Many of the countries most affected by this Mpox outbreak have limited healthcare resources and infrastructure. This isn't just about Mpox. It's about building more robust and equitable health systems worldwide, a lesson we should have learned from COVID-19. It also underscores the interconnectedness of our world. A health crisis in one part of the globe can quickly become a global concern, a reality that COVID-19 made impossible to ignore. This reinforces the need for strong international cooperation and solidarity in addressing health challenges. Looking ahead, I think we're going to see increased focus on diseases that can jump from animals to humans. Mpox is one example, but COVID-19 is believed to have originated this way too. As human populations expand and encroach more on wildlife habitats, the risk of these types of outbreaks may increase. This calls for a more holistic approach to health that considers the connections between human health, animal health, and environmental health. We're also likely to see advancements in vaccine technology and distribution strategies. The rapid development and deployment of COVID-19 vaccines showed what's possible when there's global cooperation and funding. We might see similar efforts applied to Mpox and other emerging threats. But perhaps most importantly, this situation reminds us of the need for ongoing vigilance and preparedness. Just because a health threat fades from the headlines doesn't mean it's gone for good. We need sustainable, long-term strategies for disease surveillance and response, a lesson we're still learning from COVID-19. As we wrap up, I want to hear from you. How do you think our experiences with COVID-19 should shape our response to this Mpox outbreak? Are there lessons from the pandemic that you think could be applied to this situation? Drop your thoughts in the comments below. And if you found this discussion informative, please give this video a like and consider subscribing to Opinionated Voice. We're always looking to dive into important issues, and your support helps us continue to do that. What topic should we tackle next? Let us know in the comments. Remember, staying informed is key, but so is maintaining perspective. While this situation is serious, panic doesn't help anyone. that's something we learned the hard way with COVID-19. Instead, let's focus on supporting efforts to contain this outbreak and on building a more resilient global health system for the future. Thanks for tuning in, and I'll see you in the next video. Stay curious, stay informed, and keep those opinions coming. This is Opinionated Voice, signing off.